5P study, which is an acronym, it stands for Predicting Persistent Post-Concussive Problems in Pediatrics, was a study designed to look at which children go on to have symptoms at 1 month or beyond from their time of their injury. So the design of the study was to look at a broad group of kids aged all the way from 5 years up to their 18th birthday and say what were the factors that led some children to recover more quickly and some kids to continue having symptoms at 1 month or beyond, which was called persistent post-concussive symptoms, or PCS for short. So what we found was some of the things in conventional wisdom is not always wise. So things like loss of consciousness, the number of prior concussions, while may be important when you look at one variable at a time, when you look at all the variables, some of those things disappeared. But what we did was we did what was called a multivariable analysis, where we look at all the things at once, and for that we found it factored into just 5 themes. First theme is their demographics. So are they a boy or a girl, and how old are they? And what we found is the older you were, the more risk you were on for having persistent symptoms, and girls were at higher risk than boys. The second theme is what were their past history. It didn't matter if they had many concussions, it was how long did it take them to recover from their last one. So a child who had a previous concussion and recovered within a week had the same risk as a child who never had a concussion. But those children who had prior concussions who took longer were at higher risk. Also, their past history thing that was important was that they had a history of migraine headaches in the past. The third category was, although we did a whole bunch of questions on how well they remembered a list of words or remembering digits backwards, it was a simple question is your child answering questions slowly? And if the parent or bystander felt that the child was not quite as sharp and was answering questions more slowly, that was a factor. We did a whole bunch of physical exam evaluations, looking at their neck, looking at all these other things. The one physical exam finding that made it was what was called a tandem stance balance error test. So they'd have to stand as though they're on an imaginary tightrope, and can they keep that position with their eyes closed? And those children who had a harder time with that, they were at higher risk. And then finally, although we asked a battery of symptom questions in the time of the presentation, it was the following 3 that were most important: headache, sensitivity to loud noises, and fatigue. And with those 5 categories, we were able to come up with a score that predicted ongoing symptoms better than physicians did without knowing what the score was.